So I want to introduce you all to Sorrel. She's a 65-year-old female patient who has a number of comorbidities: diabetes, chronic kidney disease, she's had a previous stroke, and she suffers from chronic lower back pain. Not only does she regularly see her GP to manage these conditions, but she also has 3 different specialists across a range of hospitals and can find it quite difficult moving between all of these. So what's Sorrel worried about? She's really concerned about this fragmentation of her care and her prescriptions, and anxious about whether the doses of all her different medications are appropriate for her declining kidney function that her specialist keeps telling her is a problem. She also worries about taking over-the-counter drugs, not sure if these could interact with any of her existing medications or are appropriate for her kidney function. This is a common problem that we see related to chronic kidney disease. In England, approximately 2.6 million people, aged between 16 years and above, have stage 3 to 5 chronic kidney disease, making up a whacking 6.1% of the population of this age group. As the UK population ages, this number is expected to increase to 4.2 million in 2036, and remains a key problem for patients with multiple other conditions. But why do we care about reduced kidney function in the context of prescribing medication? Well, a quick look at the NICE website can tell you there are lots of different issues when it comes to both prescribing and taking medication if your kidney function is low. Reduced clearance of drugs through the kidneys or their breakdown products can lead to the accumulation of toxic material and cause patients to become really unwell. As kidney function is reduced, we can also see increased sensitivity to some medications and poor tolerance of medication side effects in patients who may already be suffering from a number of conditions. We can also see the reduced effectiveness of some medications, so we can think we're giving patients the right dose of drug, but actually it's not working well enough. Many of these problems can be avoided simply by reducing the dose of a drug or by finding an alternative. But fragmentation of care between hospitals and general practice can often lead clinicians to not know exactly what medications their patients are taking. And simply coding drugs rather than prescribing them can mean that alerts designed to protect patients are missed. Furthermore, differences in the use of electronic health record systems between different primary care and secondary care providers can mean that some doctors aren't flagged when a dose of a drug may be inappropriate.
Introducing Pillar, a mobile app focused on personalized care. It provides a safe, simple support for your kidney health. What does Pillar do? Pillar provides an easy way for patients to log medications, and it also brings attention to any potential risk introduced by the patient's medication. It also facilitates patient-physician communication. Here we see a storyboard of how a patient could interact with the Pillar app. For instance, you see Sorrel, a new patient, logs into Pillar and then logs their new drug by scanning it with their phone camera. Then the Pillar app takes into account their previous metrics logged as well as their existing medication to cross-check their new medication with existing history and then flags any issues or potential risks that pops up. Then the app communicates this to their patient and allows an option to contact or email a GP on the spot. This is a initial mock-up of how we initially designed our app. It includes the registration process as well as giving options for patients to confirm their personal details and confirm any medications that they log and how a possible risk flagging would look like.
Sorrel hasn't updated her details for quite some time. Let's check out the app.
Pillar, precision dosing, personalized care, safe, simple support for your kidney health. Let's get started.
So first, Sorrel inputs her details, which are needed to calculate her kidney clearance. Certain medications which are excreted by the kidneys need to be adjusted as kidney function deteriorates. So let's type in some details.
She confirms her personal and clinical details and is shown a kidney function trend with her latest kidney clearance.
Let's add some medications. So she uses her camera to take a photo of her medication box.
She adds metformin in this instance, and using an optical character recognition, the app converts the photo to a text and asks Sorrel to confirm her drug and dosing frequency.
She also needs to add another medication. So let's add ibuprofen. Even though it's over the counter, it's still important that she has this linked.
The app then summarizes all her medications, which she can forward to her specialist and GP.
So let's process. It looks like there's some risk associated with some of the medications that she uploaded. She can either choose to send a report to her doctor, Dr. Bertrand, or she can schedule an appointment, or both. So let's start by scheduling an appointment.
Sorrel gets a confirmation for the appointment.
Perfect. And let's go back and send a report via SMS. Perfect. Now she can go back to the home page. She's all done for now.
So we know that Pillar offers a great alternative to patients to log their medications and to be able to find out if there are any interactions or required dose reductions, and to communicate with their specialist and their GP. However, we're obviously in a development stage here, and we need to consider all our other stakeholders, particularly Dr. Bertrand. When we're designing the app, we want to make sure we're taking a user-focused design method and making sure that we're involving all of our stakeholders. What we don't want to do is increase the invisible work of doctors by sending them alerts that are either inappropriate or by setting our threshold too low. What we want to do is to improve the way that they can prescribe for patients and make sure that they're doing things safely and with as much knowledge as possible. I think this just centres on how we'd have to develop things going forward, making sure that we're involving both patients and healthcare professionals in our design and development of Pillar.